A warm welcome to this video. It's Tuesday the 18th of January. Now just before we start, I know quite a few of you are concerned about the report tonight on the BBC News about flu in birds caused by the coronavirus, or caused by a coronavirus, according to the BBC News report. Now this really beggars credulity that they would get the science so wrong. Avian influenza is, strangely enough, an influenza virus, not a coronavirus. So anyone who was worried about that, don't worry about it. It's not a coronavirus. But seeing we've mentioned it, I thought I'd just do a little bit on it just to begin with, just for 30 seconds or so. So avian influenza, bird flu. Now this is terrible. There's lots of birds dying from this at the moment, but it's not a coronavirus. That's not. So this is the problem. This is one of the problems with the BBC. The reporters who report on science aren't scientists. The reporters who report on healthcare aren't nurses or doctors, and they get things wrong. I mean, this is a rather blatant example. So saying an influenza is a coronavirus is about as wrong as saying as a cat is a dog. It's just completely different. So it's an influenza. It's H5N1. And also sometimes there's H5N8 about. I'm not sure about that one at the moment, but I'm sure there's H5N1. Now, this H5 and the N1, the H and the N are both the names of particular proteins that are on the surface of the influenza virus. And the 1, 2, 3, 4, 5, 6, 7, 8, whatever it is, identify the particular type of protein on that. So that's what that means. For example, the 1918-19 pandemic was H1N1. So it's a particular type. So it's an influenza A virus subtype H5N1. And this particular one is Enzootic, meaning it's always present in animals, mostly birds, usually mostly in Southeast Asia. Then it went epizootic, so it was an epidemic, and now there's a panzootic of this, and there's birds all over dying from it, and really quite distressing scenes of birds have had to birds have died and had to be culled in some circumstances. So anyway, so it's not a coronavirus. The BBC probably gave a lot of people alarm there. There's not a new coronavirus spreading through birds. It's an influenza that's well recognised. Doesn't mean say it's without risk. I mean, if this influenza does get into people, I mean, for example, I've just made a note here actually that between 2003 and 2020, there's actually been 861 confirmed human cases and 455 deaths. So very high pathogenicity. 861 people confirmed to have the infection, and about more than half of those have died. These have been transmitted directly from birds, and there's been no real significant human-to-human spread. So it's people that are working with birds mostly, but this includes domestic poultry as well, of course. Now, I'm hoping I never have to report on that jumping to humans, but it's not impossible, but it's not happening at the moment is the answer. Now, hopefully having reassured people on that, unlike the BBC, we'll move on to look at a bit of background at the moment. Now, really interesting endgame playing out here. At least I believe it's the endgame playing out here. So here we have New Zealand. And New Zealand, like Western Australia, has well, actually no, Western Australia has got a few cases now, I think, but New Zealand's got basically no cases. So as soon as it decides to open up, basically everyone in New Zealand is going to get it all of a sudden. So quite how they're going to approach that in New Zealand, be interesting. We will keep an eye on that. Be interesting to watch. Japan and India, in both of these countries, the cases are way higher than this. The testing is a joke in these countries. India, they just haven't got enough tests for everyone. And Japan, it seems to be, Japan certainly could. So it just seems to be policy in Japan that they're just kind of letting this. I suppose they now think it's endemic in Japan. We know cases are rising because we know Omicron's there, but they're not testing, so it's not showing up. Well, they're testing minimally. Canada, where they are testing, well, no, actually, the testing has been gone down in Canada as well. So quite a few places in Canada now aren't testing. So that reduction in testing in Canada could explain that reduction. So I suspect that is not a genuine reduction, unfortunately, there in Canada. It's just lack of testing. Now, the UK testings remain roughly constant, so the UK is past its peak. I think we can safely say that now. Netherlands going up, United States could well have peaked. The United States could well have peaked about now. That is quite feasible. We were expecting it to peak between now and the end of the month. I would be surprised if it's peaked now. I did expect it towards the end of January, but it might not be far out. But that could be more of a data anomaly. The next few days will show. Ireland and Australia, well, there you go. They're now the top countries for new cases. Both heavily vaccinated countries now, of course. So that's new cases per million. Estimated effective R value. Now, the R value of 1 is here. So that's neither getting less or getting more with the R value of 1. So if we zoom in a bit. So remember, this is the R value of 1. So the United Kingdom here is actually going down. The R value is below 1. New Zealand, it's just, well, it's not that relevant because the cases are so small and they're in isolation. But here we see Canada, Ireland, United States, Netherlands. And again, they're all showing a significant reduction in the R value. So if not peaked, heading towards a peak. Australia, the R value has gone down a bit, but the cases are still remarkably high. India and Japan, again, for the number of tests that we have, doesn't really mean too much. But very reassuring there that these countries are either the UK below the R value of 1 or these countries just above. So the rate of increase at least has decreased in Netherlands, United States, Ireland, Canada. These are the variants. So Japan, United Kingdom, United States, basically all Omicron now. I suspect in the United States it's nearer 98 than 96. But that's the figure that we have. Our world in data figures always a little bit behind. Canada, again, Omicron. Australia, I'd be surprised if there's 12% Delta in Australia at the moment. I really would be surprised. India, Netherlands, New Zealand. So basically the Omicron takeover is becoming obvious now in this data. Hospitalised patients, well, the United States just stand out above the rest, and we've looked at the reasons for this. It's partly the slightly lower vaccination rates and more people are getting sicker, but it's also the large amount of comorbidities causing people to be hospitalised, largely because of the comorbidity as well as having COVID, but the COVID being the sort of, even the Omicron COVID being the straw that breaks the camel's back and sends them into hospital. So United States, hospitalisations remain high. United Kingdom levelling off. Canada still going up. And we see here that this just indicates that the cases in Canada are greatly underreported. Ireland, always a bit of a delay in the data. Australia, Netherlands and Japan in terms of hospitalisation. So Netherlands going down. Good to see there. Intensive care. Again, the United States just so far ahead of the pack in patients in intensive care, actually in intensive care. Canada, they're going up. Netherlands, Ireland, Australia. The United Kingdom, they've never gone up. They've always stayed low throughout the whole Omicron episode. They've stayed low in the United Kingdom. Japan with a slight increase in intensive care, but pretty small numbers. And just to look at a few other countries in terms of cases, I've left the United Kingdom on there for comparison. Then we go on to Sweden, United States, Belgium going up, Spain going up, Portugal, Ireland, Gibraltar, Denmark and Gibraltar and Israel particularly, very highly vaccinated countries, but very high incidence of new infections, indicating the spread of Omicron. That's all this is. So let's go now look at South Africa, because South Africa, if I'll just show you the graphic here from South Africa, if I can, if we have the technology. Let's just go back to that one a minute. Well, there's South Africa. There we go. So here we have the South Africa data. There you go, you can see it now. These are patients admitted to hospital in South Africa. So first week of the year, last week of previous year, second week of the year. I mean, it's just going down dramatically. The third week of the year, of course, the data is incomplete. It's not yet the 21st. So quite sharp reduction in cases in South Africa in hospital. The actual number of wards currently, so this is the people actually in hospital, that was the admissions, and we see it's down to people actually in hospital with COVID-19, Omicron, or all Omicron in South Africa, 7.36 thousand, just over 7,000. Not that many in intensive care or high care for the whole country of 60 million. And the number of people on oxygen in South Africa now, 948. So to be clear, there's 948 people diagnosed with SARS coronavirus 2 in hospital in South Africa who require oxygen, and about half of those we believe are incidental cases. Remarkably good news and consistent with the idea that the pandemic has basically, the peak is over in South Africa. So South Africa leads the way. Now these are the active cases. So that was the B11 wave, the initial Wuhan wave. That was the Beta wave in South Africa. That was the Delta wave. And this is the Omicron wave, and we see it's going down really quite nicely. And I would expect that to carry on going down. So we see a fairly short-lived Omicron wave compared to a fairly longer-lived Delta wave in South Africa. And when we relate that to deaths, if we just leave that graph on there, and none of you can see that one in comparison, you just about see it through there, can't you? So again, these are the deaths in South Africa. So that was the B11 wave is those deaths there. That's the Beta wave there. That's the Omicron. That's the Delta wave there. And that's the Omicron wave there. So we see there the active daily cases, and we see the massively reduced number of deaths in the Omicron wave. And other countries, so there's the Delta wave, and other countries, well, the UK is following this. The hospitalisations and the deaths in the United States are disproportionately high, but for the UK, for example, it is going pretty well like these figures. Now let me just show you some Office for National Statistics data from the UK. This is a useful summary that they publish every week. So infections, of course, have increased up to the 6th of January. It's always behind, of course. Hospital admissions are just about started to level off as of the first week in January. Deaths registered by the week were up slightly first week in January. People who'd had adults who'd had 3 doses of vaccine, 61%. Antibodies, virtually everyone, and social distancing, bobbing round about the 43 mark, up slightly, as people slightly social distance more as a result of the Omicron variant. Now, so that's the South Africa data there. Let's look at the Zoe data in the UK, because this is the most live. This is the most live data in the UK. Oh, just before we do that, let me show you that. That was the Avon government website. So it says influenza on it. So anyway, there you go. That was the hospitalisations in South Africa. That's the live data there. Always have a look at that. Now here we are. This is the people with COVID. So this is the prevalence, 2.5 million symptomatic in the UK at the moment. New daily cases, 149. Remember, we were well over 200,000, weren't we? Well over 250,000. And there we have it there. It is going down. So symptomatic cases do certainly seem to be past the peak. All this data is showing quite a bit of consistency. Office of National Statistics, deaths in the UK involving coronavirus. Now, these have gone up as of the 1st of January, unfortunately. So week ending 7th of January, it was just over 1,000 deaths involving COVID-19, up from the week before. Now, this is bad, but we had anticipated it, and we are expecting it to go down pretty soon, following following this graph here, in fact, just with a bit of delay, as we see it's past the peak. Now, So that was about one in every 14 deaths, 7.3% of deaths. But of course, many of these had significant comorbidities. Now, this was interesting. Total deaths in the UK, 13,886, 8.3% below the 5-year average. So even though this is up, we are quite a bit below for that week, 8.3% below the 5-year average. And here's the number of deaths in the UK above the average for 13th of March 2020 to the 7th of January. So that's basically all the pandemic we've got data for. And there was 127,000 deaths above the 5-year average. So that's above the 5-year average, which is probably the nearest thing we're going to get to the true death toll of this pandemic. Let's just look at some UK data while we're here. So cases, as we see, down quite a lot, but with the delay, of course, as we expected, I'm afraid. Deaths within 28 days of a positive diagnosis still going up, just showing signs of levelling off probably now. Last 7 days, 1,900 deaths, 1,904 deaths. Patients admitted just starting to go down. Virus tests conducted, what reasonable. Now, let's just look at the cases here, cases in the United Kingdom. So if we look at, this is cases, let's look at cases by date reported. And it's pretty obvious we see a big drop off there. And if we look at it on a larger scale, again, we see a pretty obvious drop off. So less cases, I think that's pretty conclusive, really. Looking at healthcare, this first one is patients admitted to hospital. Now, the number of patients admitted to hospital is starting to go down a bit, but the people actually in hospital is still, this is the hospital prevalence, as it were, levelling off. But the good news about the United Kingdom, this is the intensive care, mechanically ventilated beds. The number's never gone up and indeed is now going down. And unfortunately, though, deaths are up somewhat. Weekly deaths with COVID-19 on the death certificate by date registered, not really showing on that, but we've seen that they are up somewhat. Although that peak we looked at was probably about there. So even some signs there that deaths probably are starting to go down a bit, which is really quite encouraging. This is going to be a short-lived peak, I believe. Now, but just going back to the more detailed data, Northwest, again for the first week in January, basically 10% positivity rate, so a lot of community spread. But London, even by the first week in January, the positivity rate started to go down. So I think we can say by the 7th of January, the amount of community transmission in London had already started to drop, and of course this will be quite a lot lower now, because London peaked first. Prevalence in the UK, first week in January, 1 in 15 in England, 1 in 20 in Wales, 1 in 20 in Northern Ireland, 1 in 20 in Scotland. Antibodies, the week beginning the 20th of December, so this is a bit more out of date. 97.5% in England, 96.8% in Wales, much the same basically throughout the United Kingdom. Now, the antibody threshold for Delta, to protect against Delta, they said was high. Now, this is Delta, not Omicron, so it's a bit out of date. But they said threshold of antibodies needed to provide protection from infection for those who have been vaccinated is higher with Delta. And for Delta, more than 88% of the population had antibodies at or more the required threshold. So we see that about 88% of the people were protected against symptomatic infection with Delta back in the 20th of January. But of course, with Omicron, it doesn't protect us from symptomatic infection anything like as much. That's why the symptomatic cases have gone up very dramatically. That, and because there's been so many more cases. But we are so fortunate that the protection against hospitalisation is holding up. So 88% of people were protected against Delta, way less than that, probably about 40% protected against Omicron, but still a high level of protection against severe disease. we have been so fortunate with this Omicron that it wasn't way worse and is so transmissible. And of course, it has displaced. It's displaced Delta, which is good. Now, I'm just going to finish off with probably a strange story from China. Beijing, one Omicron infection detected in Beijing. 11th of January, the person concerned received a package from Toronto via the United States and Hong Kong. 4-day transit time. 4-day transit time. Now, in cold conditions, a virus could survive for 4 days. It's not very likely in a package, but it's not impossible either. You could certainly freeze it for longer than that. So that was on the 11th. Then 4 days later, the patient self-reported with symptoms. And the Chinese medical authorities are saying that this is an imported case in a package, because they're saying that the patient concerned had no outside contacts. This is remarkably unlikely. Remarkably unlikely. I don't know why they're saying this. Deputy Director of Beijing CDC. Omicron virus transmits fast. Please pay attention. Avoid buying stuff from overseas. Make sure you wear gloves. Don't bring packages indoors. If you have to, clean the package outside with alcohol and wash your hands. These are very unlikely modalities of spread. This is nearly always airborne and aerosolized. Airborne as in paratroopers. Dr. Ian McKay, virologist, University of Queensland. It's an airborne virus, of course it is. It's not about surfaces. Technically it can, yes, technically it's possible, but it's unlikely. There's a non-zero risk, so you can't say it didn't happen. But could it happen again and again and again, as the Chinese authorities are indicating? It's a non-starter, really. Indicating there's some transmission going on in China, of course. If you see and hear hooves, don't think zebras. It's far more likely to be community transmission. Now, the World Health Organization haven't updated their guidelines on this since 2020, actually, but this was it here. SARS coronavirus 2, contamination of surfaces and the survival of viruses on certain surfaces is the title of what we're looking at. Well, that's the title there, actually, but that's the first line. There are no specific reports which have directly demonstrated fomite transmission. So this hasn't actually been recorded as having happened, unless it's been updated. But as far as I know, that is still correct. People who come into contact with potentially infective surfaces have also been in contact with infected people. So which is which? We can't tell, of course, but it's much more likely to be aerosol spread. But it is a fact that coronaviruses and other respiratory viruses can transmit via fomites. So at the moment, there's no need to change advice on hygiene and hand washing. Although the Chinese do seem to go in for mass disinfecting of public areas. And really, given all the brilliant virologists in China, I'm not quite sure why they're still doing that. Beijing Olympics, Winter Olympics. Of course, foreign spectators not allowed. Lots of people coming in connection with the games, though, which is guaranteed to introduce Omicron. Domestic spectators are going to be selected only, whatever that means. So basically, it's not going to be a public event at all, the Winter Olympics, which is a bit of a pity. Now, yesterday we talked about vaccination and aspiration. So I'm just going to close with a few of your comments. Quintine says Canadian military medical training for the medical trade teaches to always aspirate. How sad that the army treats their patients better than civilian healthcare professionals, according to Quintine. The Fall Down says this. I used to be a nurse in the 80s and 90s. We always aspirated. When did they stop? Why? It defies logic. I agree. Danielle says, thank you for your review today. As a nurse, I completely agree in terms of aspiration. Helen, as a registered nurse with 30 years experience in the UK and the US, I have never given an intramuscular shot without aspirating first. Exclamation mark, exclamation mark, exclamation mark, exclamation mark. We agree, Helen, of course. Nell says this, 40 years plus nursing experience. And I agree that aspiration is the safest way to ensure one is not in a blood vessel. So pretty unanimous agreement from the highly experienced nursing and medical fraternity who listens into the talk. So hospitalisation is still a big problem in the United States, but the cases there will be peaking nowish to next week or the week after. It's going to be pretty soon. Hospitalisations will go down gradually over February. UK has peaked already. Hospitalisations starting to go down slightly already. Hospitalisations in London well down, of course, because they started the peak earliest, therefore they finished it earliest, showing how quickly this virus works through a population, generating immunity as it goes. And remember, just to end on one note of encouragement, if you've been exposed to Omicron, the antibodies from Omicron give you back protection against Delta, which is one of the other reasons, as well as being outcompeted, that Delta has been replaced. So there we go. I'm hopeful that we're going to be able to start not doing as much pandemic stuff fairly soon, because I think we are in the final stretch of it, at least in Western countries. Now, we did show that increase in cases in Western Europe. What is a concern is the virus is migrating east. So cases are starting to rise dramatically now in Eastern European countries, into Western Russia, in fact. And that's going to be a concern because there is quite low levels of vaccination. So I'm afraid there's quite a lot of suffering still to happen in Eastern Europe. Cases will go up now, hospitalisations will go up in February, March. Deaths will go up in February, March, April in Eastern Europe, I'm afraid. But if you're in the UK or the US or Canada or Australia, Australia's slightly different. If you're in the UK, US, Canada, it's looking, things are starting to improve, although hospitalisations in the States are still a concern. So there we are emerging from this, kicking, spluttering and coughing a bit, but we are emerging quicker than I'd hoped, thanks to Omicron. Thank you for watching.